Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we welcome back Armin Feldman. He's a physician and a medical consultant to attorneys. We're going to talk about his most recent KevinMD article titled How a Medical Legal Consultant Helped Refute a Possible Pre-Existing Medical Condition Argument. Armin, welcome back to the show.
It's a pleasure to be here, Kevin. Nice to see you again.
So we've had Armin on multiple times. If you're interested in hearing more about his story, just go to kevinmd.com/podcast. Upper right-hand corner, search for his prior episodes and you can hear about his story. But I want to go right into this most recent case. So Armin, tell me the background of this case.
Sure. Kevin, I work as a medical consultant in legal cases. I don't work as a medical expert. So I'm working primarily on those approximately 9 out of 10 cases that the attorney is going to negotiate and settle. Now, the cases are primarily in personal injury and workers' compensation, although I'll tell you that a physician in any specialty can learn how to do this work. So this case happened to be in a workers' compensation case. And this was a 57-year-old man. He was an engineer, worked in an aerospace company. And he had the habit of, for exercise, he was walking up the stairs to get to his office. And there was a worker putting some stuff on the roof. And the worker was a couple of flights up. So unfortunately, this poor guy was at the landing where he would turn to go up the next stair, and the worker dropped his tool belt. The tool belt weighed about 15 pounds, and it hit this man right on the top of his head and in his forehead. He was sent to the ground. He lost consciousness for about a minute. And as a result of this accident, he wound up with a mild traumatic brain injury and subsequent post-concussion syndrome. And he had a lot of problems, by the way, after this, and he was unable to work and his life was just turned upside down. But his biggest problem were the cognitive problems that he had. And the onset of these cognitive problems were immediate. It's well documented in his medical records from his treating doctors what the problems were. I won't go into all of it, but he had short-term memory loss, he had word-finding problems, he had difficulty with executive functioning, for example, planning and the execution of plans. He had trouble tracking conversations. He couldn't even watch television and follow it properly. And so obviously he was quite injured from this accident. So what happened was that this happened in January of 2021. And he was still in treatment, by the way. But then in November of 2021, he had an MI and subsequently had coronary bypass, 4-vessel bypass surgery, from which he had a very good recovery. What often happens in all of these cases is that opposing counsel, opposing doctors, they're often looking for some way to lay off the problems that the person has from an accident onto something else, obviously, so they're not liable. And in this case, the opposing doctors from NIME and opposing counsel subsequently were saying, we don't think that these problems are from the accident. We think this is all related to his heart attack, and then he had to have bypass surgery, and he was on a heart-lung machine, and this is clearly from that.
Okay.
And this is something that we often do. So in fact, one of the things that I do with regularity is I actually physically sit in and I observe independent medical exams done by other physicians. And then that puts me in a position to write an IME rebuttal. Now, let me say, they're very good doctors that do very good IMEs. We also know that everywhere in the country, there are doctors that get hired by insurance companies for obvious reasons.
Sure.
So the attorney that hired me, who was representing the injured worker, asked me, what is your opinion with regard to, did the myocardial infarction itself, the sequelae of that, and particularly the sequelae or problems or issues related to his bypass surgery, is that at all at play here in this man's cognitive difficulties? And it was clear that it was not. So first of all, the cognitive difficulties started immediately after the accident. It was well documented. Sometimes it isn't, by the way, that the issues of cognitive loss show up sometimes days, weeks, sometimes even months after an accident, because the symptoms are foreign to the person injured. Oftentimes they have other injuries that are preoccupying their thinking. And there's even literature, by the way, medical literature, that these symptoms are often foreign or misinterpreted by physicians as well. But this was clear that, and his symptoms were no different from the time that these problems started. And they were exactly the same after his MI and his bypass surgery. Also, in many of these cases of mild traumatic brain injury, MRIs and CT scans will be negative. That's really the case most of the time. But in this particular case, there was objective evidence that this poor man had a bleed. It showed up on the MRI. So we had no change in symptoms. We had MRI evidence prior to his myocardial infarction that was good for the case, bad for the injured person, but good for the case, that supported my medical opinion to a reasonable degree of medical probability that the heart attack, the subsequent surgery, played no role. And then we also had supporting data from the neuropsychologist that had done the neuropsych testing and then subsequently provided a cognitive rehabilitation. And so I quoted the doctors. That was my opinion. I supported that by quoting the treating doctors, by quoting the PhD psychologist in the case, so we could support the position that the injury was the immediate and proximate cause of his mild traumatic brain injury, subsequent symptoms, and the resulting complete disability.
Now, did you talk to the injured patient yourself, or was your opinion just purely based on a review of all of his medical records?
Yeah, you always ask such good questions. So in every case, here's what we do. Now, obviously, we're going to talk to the attorney involved. Then we're going to read the medical records. Then we will interview the client in every case, no matter what the situation is. Now, in the olden days, we used to typically do that by phone. Now, typically, we'll do it by Zoom meeting. And occasionally, when it's indicated, we might interview them in person in the conference room at the attorney's office. Then that puts us in a position to do whatever medical research that we need to do to back up our opinion. And for the viewers, if they want to read the report, there's a link to it, and they'll see how I backed up my opinions with evidence from the medical literature.
I'm also going to assume that the opposing party also potentially can hire medical consultants as well. So what happens when your opinion conflicts with the other side's medical expert's opinion?
We're just on the medical side, right? So we provide our medical opinions to the best of our abilities to a reasonable degree of medical probability. Then obviously it's up to the client / patient's attorney to advocate on their behalf. And what typically we're doing is trying to help that attorney to better negotiate and bring the case to a satisfactory settlement. And I can tell you, having done this for 15 years, the feedback from, I've done over 3,000 cases, and the feedback from the attorneys that I work with is that, in fact, by using our medical consultancy services, as opposed to having to hire medical experts, they are settling these cases for more money with less attorney time, and we're helping them to bring that case to settlement. Now, in those maybe 1 or 2 out of 10 cases that can't be negotiated and settled, and then the attorney's going to have to take the case to trial, then of course at that point, the attorney is going to need medical experts in every area of injury. But for the purpose of negotiating and settling the case, typically what the attorney needs is well-reasoned, thought out, cogent reports backed up by evidence from the medical literature that really any physician can provide after getting some training on how to do this kind of work.
So without being privy to the decision-making process, what was the outcome of this case, and can you speculate the influence your medical report had on the outcome of this case?
Yeah, this case did not go to trial. This was a workers' comp case, so it would have gone to administrative hearing, which has an administrative judge that has the force of law. But the attorneys were, prior to needing to go to it's really a trial, right? But prior to the need to having to go to the administrative hearing, were able to negotiate that case in a way. This argument was refuted, right? And on the basis of my report, really, but as supported by the treating doctors. But this case was able to be settled satisfactorily, meaning that the client would get the appropriate medical care that they needed to bring them to maximum medical improvement, which, is a term specific to workers' compensation cases. So I was able to help that attorney satisfactorily settle this case.
Now, of the thousands of cases that you've done, this particular case that we're talking about today, where does that fall in the spectrum of how straightforward that opinion was for you?
This was actually a pretty straightforward case.
Sure.
This claim by opposing counsel and doctors, frankly, was out in left field, and that just wasn't evidence. Obviously, in a legal case, you have a medical theory, but you need to support that medical theory with evidence. And that's how it's done. And there just was, I think opposing counsel realized there just wasn't evidence to support that particular argument that they were making.
What happens when you encounter a case where an attorney asks for your opinion that's out of your area of medical expertise?
Again, if it was going to trial, then I couldn't do that. But
Sure.
Really, any good physician is able to do this kind of work. So you size up the case, you do those things that I mentioned earlier. But one of the big things that makes first of all, the way our legal system works, a physician is able to give a medical opinion about medical questions. But we have to back up our opinions with evidence from the medical literature. So in specific answer to your question, it doesn't come up very often that I feel I can't help that attorney. Now, if I can't help the attorney, I can certainly help the attorney to get an expert in the field. But most of the time, almost all the time, I can support my medical opinions with evidence from the medical literature. And by the way, it would be the same medical literature that an expert would rely on.
Now to give us a sense of this particular case in terms of how long it took you from reviewing the medical chart to writing a report, in general, how long did it take you to do that for this particular case?
This case was 10 hours of my time.
All right. We're talking to Armin Feldman. He's a medical consultant to attorneys. We're talking about his most recent KevinMD article titled How a Medical Legal Consultant Helped Refute a Possible Pre-Existing Medical Condition Argument. Armin, tell us some take-home messages that you want to leave with the KevinMD audience.
So I guess one of my biggest take-home messages is if physicians, by the way, I'm very pleased to say I've been doing this 15 years. I've been training other physicians to do this for the past 13 years. I've trained over 1,600 physicians. And I'm very pleased to say this is really becoming a new subspecialty of forensic medicine. And there are physicians all over the country that are doing this once they get some training. And it's actually very well accepted in our legal system to use a medical consultant for these kinds of issues. And use your medical experts if you're going to trial. So as a physician, if you enjoy medicine in general, if it was exciting to you to be in medical school, if you want to learn about all kinds of various aspects of medicine and really help people in a way that they weren't afforded this help in the past, and be able to see the tangible results of what you're doing, then this is something that you might want to consider.
And how can people reach you?
Sure. Probably the best way to reach me is send me an email at Armin, ARMIN, at MDBIZCON, MDBizCon, short for MD Business Consultants, MDBizCon.com.
Armin, always wonderful to have you back on the show, sharing your story time and insight.
It's a pleasure to be here.